Hello and welcome to Health Life at Seniors Today. First of all, we wish you a very happy Diwali belatedly, Sal Mubarak, and hope you had a great festive season. I know there are crackers. Air quality is quite bad in some of our cities with all the fireworks across and the crop burning. But be that as it may, hope you've had a good festive season. We are all excited to be back after a week's break on our Health Live series. And today, I'm delighted to have a very senior medical practitioner, Dr. Niraj Vora, here with us. Dr. Niraj Vora is one of Mumbai's and one of, if I might say, the country's top orthopedic surgeons. He's a specialist in joint replacement, trauma surgery, and the all new, may not be all new right now. It's been fairly there, been there for a while in robotic surgery. He is a specialist in total replacement and trauma surgery. His specializations include primary hip and knee replacement, revision hip and knee replacement, robotic knee replacement, trauma surgeries. And he is a medical practitioner, as I mentioned, with the Nanavati Hospital. And he is works full time with the Nanavati Hospital. And we are really delighted to have him here. Welcome to Health Live at Seniors Today, Dr. Vora. How are you?
Thank you very much. I'm very well. Thank you very much for having me. I just looked at that AV, well, the V that played, and I'm suddenly feeling very, very privileged and honored to be part of this because I looked at the people who've come on before, and some of them are the absolute legends of the medical field. You know, so I'm beginning to wonder that have you got the right person for this, or have you by mistake sent me this invitation? I'm not really sure about that anymore.
In fact, I should ask you. I should wonder to myself as to why didn't we have you before?
That's so kind of you.
No, I
Thank
must
you.
I must mention over here, just before we came in here, Dr. Vora comes from a family of orthopedic greats, if I might say, in the city of Mumbai. And so I'm sure as a child, were you discussing bones and stuff like that as you were having a breakfast and
Uh,
meals?
well, here's the thing. So my dad was an orthopedic surgeon in South Bombay. We had our own nursing home opposite Roxy Cinema and Opera House, which my mother used to run. And I attended my first surgery when I was, I think, 8 or 9 years old, which
Wow.
was, and I still remember this, it was an amputation of a leg of a patient by the name of Mohan who had a cancer in the bone. And at that time, we are talking, 1975 or something. That time, there was no other treatment except that. Things have obviously moved on since then. And I still remember I attended that and I asked my dad that why is that leg turning blue? As the blood supply goes, the leg changes color. And my mom had got special little gowns and slippers and everything made for me. So I suppose, but the thing is, my parents, neither of them have ever pressurized me to become a doctor. Forget orthopedic surgeon, not even a doctor. I remember when the results of the 12th standard were about to come, Papa said, look, you don't get marks for medicine, it doesn't matter, right? Just be good at what you do and be happy. And that was it. When my third MBBS marks came out, when you decide whether you get into orthopedics or what do you do, again he said, don't become an orthopedic surgeon because I'm one. Expect no help from any quarter. You do it because you want to. So I've been very lucky that way that I was never pressurized into this. It's something that I just gravitated to. Maybe subliminally, all the discussions at home played a role in it, but there was never any pressure.
And you didn't think of I was reading your profile and you are into scuba diving and all of that. Did you ever think of just doing things underwater?
Well, next Saturday at this time, I'm going to be scuba diving in the Andamans.
Wow.
I go there 2 or 3 times a year. I've been doing this for the last 10 years. I've done more than 400 dives now. So yeah, so that is my passion. I love doing it. I mean, we can't operate under the water. That I live there. I live in the Andamans. I tell you, it's such a beautiful place. I'm sounding like a bit of a ambassador for tourism there, but uh, I'd urge everyone go visit the Andamans at least once.
Great. Thank you. And we have around 180 odd people in the room today. So over to you, Doctor, for your presentation. And
Thank you.
even as Doctor is getting ready with the presentation, do remember that this is being recorded on October 25th, 2025. So if you do watch it, say 2 years from now, do remember that some of the things that Doctor may be speaking may need an update. So you can keep visiting our platform. And perhaps we'll have Dr. Vora once again after a couple of years
My pleasure.
earlier. And yeah, and this is being recorded, and it'll be the video will be up on our website on Monday evening. If you do have any questions, please listen to the presentation, and no need to take our notes, etc., because this video will be up on our site. And yeah, you can ask your questions after the presentation is over. Over to you, Doctor.
Absolutely. Thank you very much, Pradhuman. Really appreciate that. A very good evening to everybody. Thank you for having me. I just make two statements clear right at the beginning. Number one is that I had a look at that email that was sent out and my picture. My God, I look bad. I hope I'm not looking as bad now. I have combed my hair and tried to make myself look a bit presentable. So that's one. And second is I'm recovering from a bit of a cold. So I might get a bit of a coughing fit in the middle. I promise you I don't have TB or COVID, uh, but just put up with me for that. And now with that, let's get down to business. I'm going to share my screen. Uh, let's hope that it works like every time.
Yeah, it is
Yes,
coming on.
perfect. Right. So what we're going to talk about today is osteoarthritis of the knee, and I'm going to try to simplify a few things for you, and then we'll touch on a few newer advances that have happened, which are beneficial to the patient. Newer advances happen all the time. Whether they're beneficial to the patient or not is always a subject of significant controversy and debate. So the first question is, what is, okay, why is this not moving? Hang on. Okay, you know what? I might have to just restart the whole thing.
Just 1 second. Yeah, no problem. No problem.
I'll just stop sharing for a second.
Yeah.
There we go.
Come on, right.
Right. So we'll talk about osteoarthritis. Now, arthritis, there are many types. Osteoarthritis is the main one, which is generally age-related wear and tear. There are others like rheumatoid arthritis and psoriatic. We will not go into those details. We just talk about the simple, standard one that you see every day in daily life. So, what is arthritis? Now, there are three. We divide the knee into three groups, three parts, compartments, we like. Uh, for description. And when there is wear and tear of the articular cartilage, which is the smooth coating of the joint, which allows the joint to move freely, it is known as arthritis. So the compartments are the lateral, which is on the outer aspect of the knee, as you can see my mouse moving, the medial, which is the inner aspect, and the patellofemoral, which is that mobile bone in front of your knee. It's called the patella or the kneecap over there. Now, this is caused by a multiplicity of factors. So there's no one reason why you get arthritis. So, a lot of patients ask us that, doctor, what can I do so that I don't suffer from the same problem my father, my mother, or my wife or someone is suffering from? And the answer is, well, not a lot that you can do because there's no one single cause that has been identifiable. So there's no single way to tell you, well, don't do this or don't do that. So the anatomy, the knee looks a bit like this. So you can see that the bone over here is the femur or the thigh bone, the tibia or the shin bone, the patella or the kneecap, which is the bone in front of your knee. The blue or the purplish things are the articular cartilage, which I was talking about, the smooth cartilage. The ligaments are inside the knee and outside as well. When this cartilage wears off, that's when you start developing arthritis. So it's a self-perpetuating thing. Once a little bit of the article flakes off and makes the joint a little bit rough, it keeps happening. It's a bit like a carpet at home. Once the carpet starts to get a little bit rough, every time you walk over it, you're making it rougher and rougher. So once it's begun, it's a bit like graying of the hair. It's not going to stop. The rate at which it progresses is variable depending on one person to the next. but we know for sure that this is going to keep getting worse. What are the risk factors? Well, I mean, there's a multiple things. Age, as you grow older, you're more likely to get it. Women in India seem to be more predisposed to it, presumably genetically, we're not sure. Obesity, the heavier you are, again, the more likely you are. But that's not to say that if you're thin, you won't get it. It is just what's going to make it more likely. If you had a previous knee injury, so my sister had fallen 200 feet while rock climbing in 1983, and she smashed her left knee up. And my dad, as we mentioned earlier, was an orthopedic surgeon. He put her back together in 83. And in 2018, I did her knee replacement. Now, that was purely because of that injury. She was 53 years old when I did her knee replacement, which is relatively young. Lower extremity malalignment. Some people stand, when you look at them, they've got bowed legs or knock knees. These people are also more likely to develop these problems. Repetitive knee bending and high impact activities, I don't think there is enough compelling evidence to say that they are likely to cause this problem, because otherwise Kapil Dev, Sachin Tendulkar, Rahul Dravid, all of them should be having arthritis by now because of the number of times that they have repetitively bent their knee. So these two things are a little bit, though every doctor will tell you, don't do this, don't do that, don't do that. We'll come to that in a bit. How do you know whether you have arthritis or not? So not all knee pain is arthritis. So if you have knee pain and have at least 3 out of these 6, if you're more than 50, if your morning stiffness lasts for less than 30 minutes, so you wake up in the morning and the knee is, oh man, this is so painful, and goes on about 10 or 15 minutes, everyone has a bit of stiffness, for maybe a minute or two in the morning. That's nothing to worry about. But, if it's more than that, 20 minutes or so, then that's when you got to start thinking. Crepitus, when you bend your knee, you will hear noises from inside the knee. That's called crepitus. Bony tenderness, you press the bone and it hurts. Bony enlargement, the knee will look swollen. And no palpable warmth. That means that the joint should not feel hot when you touch it, because that could be signs of an infection. So if you have 3 out of these 6, you need to go and see your local friendly orthopedic doctor, who will in all likelihood ask for a X-ray of the knee. This is what a normal knee X-ray looks like. As you can see, the gap between the 2 bones is absolutely normal and equal on both sides. When you start developing arthritis, you can see that the gap is becoming narrower. You can see the gap over here is still maintained. Over here it's become narrower. And then finally the gap completely disappears. As you can see, there's no bone left. And this is the stages that arthritis goes through. And intervention is possible at every stage in an attempt to try to slow down its progress to the next stage. So what do we do? First is we try to manage lifestyle. So your doctor will tell you weight loss, right? We all need to lose weight. However much we think, everyone says, nahi yaar, mera thoda to kam karna. You never hear anyone say, haan, nahi, mera vajan thoda badhana padega. So we all need to lose weight. And the way to lose that weight is to zip it. You have to zip up, because that's the only way you are going to stop eating. So go to a good nutritionist, get a proper diet plan. Starving yourself is not a way to lose weight. You will in fact put weight on because of the way the metabolism of the body works. You will find yourself putting on weight if you just decide, you know what, I'll only eat half a meal a day, I'll not eat anything else and all. It doesn't work like that. Exercise. You must do regular exercise. Now, this is a public service announcement. It is not just if you have arthritis or anything. As we grow older, we all begin to lose muscle mass. It's a condition called sarcopenia. It happens to us all. It spares nobody, not even Arnold Schwarzenegger. So we all have to keep exercising. You must do resistance training. That is lifting weights. Now, you don't have to lift 100 and 200 kilos. Even 5 kilos is good enough. But you must do that. That will keep your muscles strong, and impact training helps strengthen the bone. So all of this will help. If you find that the joints are very painful, then you can do stuff like swimming, cycling, using the elliptical or the cross trainer in the gym, because that does not put high impact through the joints. Eventually, you may find that you need a walking stick or a walker, and there is no shame in using one, because it is more embarrassing to be found on the footpath lying down because you tripped and fall, rather than having a walking stick in your hand. Insoles and unloader knee braces, I always mention this because there is no scientific evidence to suggest that these make any difference. Now, I'm talking about the unloader braces, okay? These are the braces which you will typically see at 3 o'clock in the morning on a shopping channel on one of your satellite TV stations, where they will tell you कि पहले मैं बहुत ही मोटा था और मेरे कोई दोस्त नहीं थे and all the rest of it. And then for 30,000 rupees only, you can have this knee brace and your arthritis will be gone. That does not happen. The only people who actually benefit from these knee braces are the manufacturers. So these insoles and knee braces make absolutely no difference. How do you manage it? Medical. So I was in the UK for a while and then I came back to Bombay. When I started my practice in Bombay, every patient would come and say, doctor, कुछ दवाई तो लिख के दो. And I'm like, आपको जरूरत नहीं है. नहीं नहीं कुछ डॉक्टर कुछ अच्छा कैल्शियम विटामिन कुछ तो लिख के दो. So I realized that the Indian patients love getting dawa from the doctor, right? एक दो दवाई नहीं लिखा तो डॉक्टर कुछ मालूम नहीं है. So we always open the innings with glucosamine. Glucosamine is a health supplement. It's like a vitamin. It has no side effects to it. It has glucose in the name. It doesn't have glucose in it. So diabetics can have it as well. This is a vitamin for the knee cartilage. It makes the cartilage stronger and reduces the rate of wear and tear. As the cartilage gets stronger, your knee pain also reduces. So despite it not being a painkiller, it helps with the pain. If you find that, no, it's still not working, then we go to what are known as NSAIDs, non-steroidal anti-inflammatory drugs. Your Brufen, Vora, Mobizox, aceclofenac, Asenac, naproxen, all those, they're all part of the same family. These unfortunately will cause you a bit of gastric irritation. Long-term use or abuse can cause kidney-related problems. Therefore, one has to be careful with how you use them. The gastric problems are instant. The kidney problems happen over a number of years. So the pharma industry realized that, oh, you know what, this gastric problem needs to be sorted out. So they came up with another class of medications called the COX-2 inhibitors. And these COX-2 inhibitors are what you would call as stomach friendly. So you don't get that much of a gastric reaction with these. So if you are sensitive, you must tell your doctor that please give me something which reduces the acidic response in the stomach. Next step up is the opioids. In the market, they're called Ultracet or Tramzac. These are morphine derivatives, very, very powerful, but highly addictive. So these are to be used. We use these only in patients who have got post-operative pain. Otherwise, it is not a good idea to prescribe opioids to patients. Supposing all this also is not helping you, then we talk about injections. You must have heard that so and so got an injection and uska to sab theek ho gaya, isne injection liya, usne injection liya. So there are two types. One called glucocorticoids. These are your standard steroid injection, which is given inside the knee. It has no side effects. It does not travel into the bloodstream. Therefore, you will not have any body effects of steroids that you may have heard of. You will have heard steroid lene se ye hota hai, wo hota hai. None of that happens with these injections into the knee joint. These, however, are not, we cannot predict their benefit. Some patients find that it helps them for 10 days. Some patients find that one injection helps them for 6 months. Nobody gets worse off with it. So there is no harm in trying it. But these are meant for patients who are ideal candidates for surgery, but do not want to have surgery for whatever their reasons are. The hyaluronans, or what is we would call them as the gel injections, are in those patients who are in the early stages of wear and tear or arthritis, where the x-rays haven't begun to look too bad yet. These injections help lubricate the joint and strengthen the cartilage. Medical evidence over here shows that in the correctly chosen patient, you have an 80% chance of being happy for 1 to 1.5 years, after which you can have another injection. Remember, as I said right in the beginning, this is a progressive condition, wear and tear. So we are only managing. At the top, you can see a written management. It's not cure. So we are just trying to keep the patient comfortable while nature is taking its own course. Then in the end, it comes down to surgery. So, you have to have an operation because the pain is affecting your quality of life. So that is the time when you must have or consider having an operation, is when your knee pain has not responded to the standard conventional treatments. and is now affecting your quality of life. And this is different for different people. Some people's quality of life gets affected because they are not able to walk the marathon. Some people's quality of life gets affected because they can't climb Mount Everest. And some people say कि मेरे को क्या फर्क नहीं पड़ता. I am sitting at home reading the newspaper and watching Tarak Mehta. I don't care. So everybody will respond differently to the same problem. There are multiple operations that can be performed depending upon at which stage you intervene. But we'll keep our talk restricted to totally replacement. Yeah, otherwise this will just go on till tomorrow and you all will all fall asleep. I hope no one's fallen asleep yet. So when do you do a knee replacement? You do the knee replacement when the entire joint is affected, when there's severe pain and there is functional impairment. That is that quality of life. The reason you should consider getting the operation done is for relief from pain. That is going to be the main thing. How much will my knee bend? All those questions, while they are important to you, should not be a factor in making the decision. Pain relief should be the primary objective. So you get pain relief, you have improved mobility, and there is restoration of quality of life. You are able to do stuff that you otherwise were unable to do. So what happens in a knee replacement? You get admitted, we operate on you the next morning, and we make you stand up the same evening and make you start walking the next day onwards. Common questions, doctor, how painful is it? We have heard it's a very, very painful operation. Of course, it's painful. I mean, it's a cut in the front of your knee. We've gone in, we have used the hammer, we used the drill, we used the saw with the robotic arms as well. There are burrs and saws and everything. So it's bound to be painful. But we know that it's painful. So we do our best to keep the pain down. We use this thing called an epidural. We have all kinds of other medications that we use. So how much pain will I have for the surgery? We give pain marks out of 10, where 0 is no pain and 10 on 10 is horrible pain. Most patients' pain will be either 3 on 10 or lower than that. So it's not going to be as painful as you're imagining, and it will not be as painless as you want it. It's going to be somewhere in the middle, but you will be able to comply with pretty much all the physiotherapy instructions, etc. So do not hold back the operation because the fear of pain. It's not as bad anymore. Use of robotics, we'll talk about that in a moment. Minimal invasive surgery, I am mentioning this only to tell you that don't fall for it. It's a marketing ploy. Doctor, how big will the cut be? It doesn't matter. My boss used to say in the UK that incisions heal from side to side, not end to end. Most surgeons will keep an incision as long as they have to keep it, but as short as they can safely keep it. Because remember, we need to be able to see everything that we are doing inside the knee. So if the incision becomes 6 inches or 4 inches, it's not the end of the world. So please don't get hung up on how big the cut is going to be. Guarantee 100%? No, 99%. 1% risk infection, which is very low these days in most high volume surgeons, people who do this all the time, every day throughout the year. You will find that most of their infection rates are 1% or lower, which is as low as it can ever get. Deep vein thrombosis is the formation of clots in the veins of your leg. Now, this statistically, you have about 2.5% chance. Most of us give blood thinners to patients for 2 weeks, which is the international guideline, so that you don't develop this problem. But I will honestly say that I'm unable to remember my last patient who had a DVT, as we call it, or deep vein thrombosis. Somehow I feel that the Indians are genetically resistant to this problem. And I'm not saying they're immune to it, but they're certainly not as frequent as it was when I was in the UK. Pain. Now, pain is a very personal thing. And what may be a lot of pain for me may be nothing for you. But we find that there is a small minority of patients who complain about pain for anywhere up to a year when there's nothing wrong. So, you do x-rays, you do scans, you do everything, you can't find anything. The patient's obviously not happy. They go and seek 2 or 3 other opinions and everyone tells them the same thing. Just wait. And most of them at the end of 1 year or maybe 15 months will settle down. Now we come to what's new. So, we've been hearing these talks about knee replacement forever. But has something happened or not? Everything is moving ahead in the world. AI is coming. What are you guys doing? So now, you will have heard that knee replacement lasts 15-20 saal chalta hai. Some people say 10 saal chalta hai. One sec, huh? Sorry about that. So a lot of you will not have that first surgery because you're worried कि 20 साल 15 साल 10 साल के बाद वापस करना पड़ेगा तो क्या होगा. As a consequence, what happens is you lose out on the simple pleasures in life, playing with your grandkids, or going for that holiday that you wanted to go to Europe or the US or Australia or wherever. Everything comes to a halt because you're waiting for that magical number of 70 years. मेरे को बोला है 70 years पे operation कराओ. So this is what has been holding us back in the past. Now, what if I told you that there is this part or the implant that we use which has 85% less chances of wear, 160 times smoother, right? The smoother the part is, the more freely it glides, 50% lesser friction, 4,900 times less volumetric wear. So every part as it wears out, the plastic produces wear, and you have 4,900 times lesser wear, twice as hard, and at least as strong. You'd say, why 2 knees? Doctor, mera 4 knee replacement kar do. So this is what it is. It's a part that is called as oxinium or oxidized zirconium. The brand name is Oxinium. It has shown an 85% reduction in wear over 45 million cycles. Now, the average human knee goes through about 1 to 1.5 million cycles a year, depending upon your level of activity. So the older you are, the lesser active you are. It has been shown that 45, so that's about 30 to 35 years minimum that it has shown reduction in the wear. There's no nickel content. I'll talk about that in a second. It's 20% lighter, but this is just marketing. I'll be blunt about it. Your average knee replacement weighs about, I think, 400 grams approximately, 20% lighter. Yeah, I mean, that's really nothing. Yeah, but we still say, "Arey, wo thoda halka lagega aapko," and you will also say, "हाँ, lagega." And it's not something new. It's new, but not new in the sense that it's been used since 1997. So we've got very good long-term data to show that it is safe for the patients. There have been a few implants which were brought out in a big way, massive marketing drive, etc. And 5 years later, they were found to be failing, and that created a lot of problems. Well, then that's not the case with this particular implant. I've been using it in India since 2011 when it first entered. I was using it in the UK before I returned. It's very strong, as you can see that they do all this bench testing, and it supports 1,000 pounds, right? So 1,000 pounds is about 400 and something kilos. I'm sure that none of you all weighs that much, so you need not worry about the fact that will it be strong enough to support my body weight. This is the thing about the nickel allergy. So nickel is a common component in knee replacement implants. And nickel is the thing that causes you, if you wear jewelry and you start getting itching around your wrists or around your ear or your neck, that is nickel sensitivity. And there is evidence to show that if you have nickel sensitivity, you may not respond well to the traditional cobalt, chrome, or the steel implant because that has a 1% nickel content. The zirconium has no detectable nickel content. So we tell patients that if you are allergic or sensitive to nickel, then we should use this Oxinium or the 30-year part. Now we'll come to the last one, which is the robotic knee replacement, which everyone is talking about these days. There's a lot of awareness being spread. We have been using robotic assisted knee replacement in the city of Bombay since 2022. I was part of the group which started it off in the western suburbs of Bombay. It has been in use internationally for a long time and in Pune for a very long time. Bombay has just recently sort of joined the party. So conventional surgery, that is what has been happening ever since knee replacement has been devised at the sort of early 1970s. It all depends upon how good your surgeon is, how good his judgment is, how good is his eye. Can he, those kind of things. So it's a bit like you bring home this bookshelf from IKEA and you're trying to set it up yourself, with one screwdriver in your hand and you're sitting over there and doing it. And it's going to be only as good as you are. What happens in robotic assisted surgery is that the robotic assistance helps us be more precise and more accurate in what we're doing. So it's similar to having a power assisted drill when you're trying to build something instead of having a screwdriver in your hand. And what it does is it gives you real-time information about that specific patient's knee. Not all knees are the same. And looking at an X-ray, it's not enough. You need to have real-time data, and that is what robotic assistance gives you. So you get more precision. The more accurately you're able to put the part in, the longer it is expected to last. And that, I think, just stands to logic. If you are building a building, for instance, you want it to be standing absolutely straight at 90 degrees to the ground. You know that way it will last the longest. If it's a little bit off, then you are always going to be worried कि अभी ये खड़ा रहेगा कि गिरेगा. So this helps us get the part in absolutely perfectly, specific to your anatomy, not to Mr. Bhadrej Bhai's anatomy, who is your neighbor 5 buildings down who had his operation done. So this is going to be specific to you. And what we find is that patients who undergo robotic assisted surgery seem to be recovering faster compared to patients who undergo traditional surgery. And that's probably because we don't do as much soft tissue uh, releasing or freeing up soft tissues with robotic assisted surgery. And it's too technical to get into that. But so the lesser the soft tissue work you do, the lesser the pain patient gets after the surgery. And this is the reason we have sort of begun to realize that, and patients also, I think, are beginning to realize that this is making a difference. Their friends are telling them that, look, you know what, I had my knee done or my hip done robotically, and I really had no problem. And as a consequence, we are getting more and more into the field of artificial intelligence in orthopedics. What are the types of robot? Now, because the thing is that, every surgeon you go to will have a different robot. In the city of Bombay, there are 5 different companies that make robots. The problem with robots is that they're implant specific. So if I am using robot A, I can only use the implant from company A. If I'm using robot B, company B. You cannot say कि नहीं हमको company C का implant डालने का है, आप robot करो and I'm using robot A. I cannot do it. So there are different types of robot. Broadly speaking, image based, where you have to have a CAT scan done of your knee or your hip, which is fed into the robot. Data is extracted from that, and then the plan is made. Or you have imageless systems where you don't require the CT scan. We just do the mapping of the knee joint during the operation. So real-time mapping is done, and we get all the data that is required and base our procedure on that. Then how does it cut the bone or prepare the bone? So one is burr-based, where there's a high-speed burr that we use to, sort of trim down the bone. And these are all haptic, which is that if it is not where you have told the robot it should be, it will not work. So it cannot damage any ligament or any muscle or anything that is not supposed to be damaged. The saw-based ones also, some have the haptic control and some don't, where you use a traditional saw. Again, it really makes no difference. There is nothing called the best robot in the world. They all do the same job a little bit differently. You have to, if you are considering getting robotic joint replacement done, choose the surgeon wisely. It does not matter what robot they use. If they are coming across to you as sensible, balanced, experienced, and willing to listen to you, you should go with them. So we find that you have more accurate implant placement, you have customized bony cuts. Every patient's knee is different, and we are able to customize it to what your anatomy is. Lesser pain, lesser blood loss, and a quicker rehab. So patients are independently mobile sooner than they are with a non-robotic system. This is just to show you, if you look over here, my mouse is there. That is the type of accuracy that we can get. We planned a 2 degree and we got it at 1 degree. Now, the naked eye cannot tell between 2 and 1. And that is what the robot helps us to do. Some people wonder that, doctor, but we heard that robot means aap to rahoge na operation mein. And the answer is yes. The robot is under direct control of the surgeon at all times. So it is not that the surgeon is sitting in some room somewhere else and having chai coffee while the robot is doing the work, like you see with all these car factories and all of that, where there's no human being visible. That's not the case. So here, the surgeon is in full control and full command. The robot is only acting as an assistant. The robot is not doing the work. So do not worry about that. Quick recap. This is what arthritic knees look like. You can't even tell where the joint is. You can see that this whole thing has become one big mass. If this is what a normal knee is supposed to look like, this is what it's looking like now. And then you can see that with the knee replacement, we are able to make it look like a normal knee. even in severe deformities. You can see this lady's got bow legs. She'll never be able to play goalkeeper for any football team because the ball would just go right through. But the next morning after surgery, we straightened her legs out. She's standing up. So knee replacement, generally speaking, and this is not robotic or not robotic, I'm talking about the procedure, has now reached a place where one can be confident in offering the patient predictable outcomes. That you will do this at 2 days, at 5 days, at 2 weeks, at 6 weeks, or whatever. So please don't hesitate. If you are sitting on the fence, just take the jump. You will not regret it. Now, I haven't been able to see everyone's screen. I don't know whether you're able to see me also or not, but that's not important. I hope no one has fallen asleep. The credit for that should go to these two people. As I had alluded to earlier, my dad, Dr. Lakshmikant Vora, was an orthopedic surgeon south of Bombay. He passed away when he was 90, worked till the last day of his life. Mummy, Mrs. Bindubain Vora, we had a nursing home in Opera House opposite Roxy Cinema. Mummy used to run the nursing home. She retired in 2001 and then spent the following 20 years of her life teaching the Dhobis children geography and maths and all kinds of things. And now those Dhobis children have become chartered accountants and lawyers. So, yeah, so they are the ones who always encouraged me, never held me back, gave me all the opportunities I could. And if I am here today, it's because of the two of them. And I always like to acknowledge them in my talks. My email address is at the bottom right of your screen. You can make a note of that. Once this is over, if there's any questions, queries, worries, or doubts, please drop me an email. I will reply to all emails within an hour or two. And I think that's the end of my talk. If there's any questions, I'm more than happy to take them.
Thank you very much, Doctor. Thank you very much. And I think your last slide was amazing. Of course, the entire presentation was amazing, but it's really nice that you acknowledged your parents and the way you did it was amazing. We have quite a few questions that have come in, but I'm just going to ask a few which you've perhaps not addressed. This is from Bharat Mehta, who's 68. He says, how and what is easy way to protect from osteoporosis? Any treatment where you can save from surgery?
Okay. So I think there's a bit of a mix-up here. Osteoporosis is a different condition compared to osteoarthritis. We'll stick to osteoarthritis. Is there any way to avoid surgery? Answer is no. It is if you have been advised it is likely you will require it. When, it's up to you. So this is never a medical emergency. My father, it took him 10 years, and he's an orthopedic surgeon. It took him 10 years to decide that he needs knee replacement. At the age of 86, I did his knee replacement. Right? So the sooner you get done, the better it is. Papa just wouldn't listen. So there's no way to avoid the surgery. Unfortunately, it's a bit like saying, well, doctor, how do I avoid getting gray hair? You can't. If it's going to happen, it's going to happen. And you just have to accept
that. Right. We have a question from Apurva Mehta, who asks, Doctor, I am a senior citizen, 81, have some knee cartilage wearing, hardly any pain whatsoever though. Can you suggest some exercises so that to prevent a total knee replacement? I have begun swimming and do feel better with it.
So I think swimming is probably one of the best things that you can do because it works out the full body without causing any stress on the joints. The other thing I would suggest is that if you have access to a gym, then you can use the exercise bike over there because that also helps to strengthen the thigh muscles, which is what you need strengthening of. Finally, you can go and see a good physiotherapist who will be able to put you through a whole drill because there's about 20 different types of exercise that can be done. And they will sort of, give you a little chart, printed out chart, etc., which you follow at home, and you can do the exercise at home. But swimming, cycling on the static bike, and the use of cross trainer as opposed to treadmill are probably the best things that you can do.
And swimming, would you suggest warm water? Swimming
makes no difference. I would love warm water, but a lot of the gyms, everything is in open air, and we don't have temperature control over here. It's very expensive, so you just jump in. Thanda hai to kya ho gaya? Just jump in, and you'll warm up. So just go for it.
We have a question from Meena Goyal who asks, does varicose veins and arthritis link each other in the old age?
No. So varicose veins is a completely different condition. from osteoarthritis, though they both happen on the leg, obviously. Varicose veins affects the superficial veins of the leg. And even if you are due to have surgery on your knee, the varicose veins is never a deciding factor for that. So you don't need to worry कि varicose veins की वजह से knee replacement बराबर नहीं होगा. There are two different conditions. Most people who seek treatment for varicose veins is because one, they don't like the cosmetic look of it, and the other is that they find that they get dragging pain in their calf and feet if they stand for prolonged periods of time. So that is when they seek surgery. Otherwise, you can usually wear, compressive stockings, etc., which usually takes care of the problem.
Right, thank you. We have a question from Mr. S.C. Koti, who's 74. He says, I don't have pain in the knees as such. I'm active. Was running half marathon for 15 years. Now for the last 6 months, I'm gymming. My gait has changed. There's a noticeable limp. Knees are stiff when I get up after sitting for long or after sleep. Pace has slowed down. Do I need to go for knee replacement for improved quality of life, like brisk walking, trekking, long drives, jogging if possible? That is Mr. S.C. Koti, who's 74.
So, Mr. Koti, I would suggest you go and see your local orthopedic surgeon who will do x-rays. From the way you're describing it, it certainly sounds like you are going to be a candidate for a knee replacement. Given your lifestyle and what you are aspiring to, I think that you should consider getting it done if your doctor advises you that. But first thing is, get a proper x-ray evaluation done and see your local orthopedic surgeon, please.
Right. We have a question from Aruti Ghosh, who's 67. She says that I had a hip replacement a year ago. I'm walking without any support, but sometimes when I get up from bed in the morning, I feel pain like everything is stuck. I have trouble walking. What should she do?
So this is a difficult thing. Now, whether it was a total hip or a partial hip replacement, whether this was because second to if you had a fall and fractured the hip, then usually a partial hip replacement is done, which is called as a bipolar. Or a total hip is done usually if you have arthritis of the hip, which is not very common in the Indian population. Anyway, be that as it may, this is what I was saying, that some patients have prolonged feeling of pain, which takes a long time to go away. So currently, I would say do nothing. If you're finding that is happening to you every morning, then at night before going to sleep for 2 or 3 weeks, have an anti-inflammatory, Brufen, Vora, Comiclam, one of those things, and see if that helps you or not. But for the large part, I would say do nothing. It will wear itself off gradually over a period of time.
Right. We have a question from Shobha. I think she's in Delhi. She is in 2014, I think she says, my doctor suggested knee surgery for both the knees, but I managed with exercise. Now I have pain once in 3 months while climbing stairs. I take Nucoxia 120. Is it okay, harmful? I had arthroscopy in 2006.
So Nucoxia is that non-steroidal anti-inflammatory drug, is the COX-2 inhibitor. So it eventually is going to affect the kidney. Eventually, I don't know when, and I'm not trying to be a scaremonger here, but it will. You are probably not having as much pain, perhaps because you have modified your lifestyle and activities to sort of make sure that your brain is telling your knees don't do this and don't do that, and that's why you're not getting the pain. It's not that you've beaten the arthritis, you can't. So my advice is go to your doctor, get the knees evaluated, get them x-rayed, see what is going on, and then make a decision.
Right. There's a question from Sunita Verma. Is bending of the foot toes due to arthritis? What should one do to correct it?
No. So I think what you may be talking about is when the big toe or the angutha of the foot starts to go off to one side. That is a different condition. It is, in medical terminology, we call it hallux valgus. Common language, we call it a bunion. And that is completely different. That is not related to arthritis in any way. And because the big toe starts to go off to one side, the smaller toes try to stand up or sort of, go up, and they start bending, trying to make way for this big toe that's coming. There are surgeries that foot and ankle surgeons will do to correct all of this and give you a straight looking foot again.
Right. She's asking another question. Do you recommend sitting cross-legged or in case of a knee pain, or is it good to sit cross-legged and do pranayam, etc.?
Yeah, absolutely. No problem at all. At any time. This is all a myth that is being propagated. Never sit cross-legged. That's all nonsense. Absolute nonsense.
Okay. This is a question which I'm not very sure whether you would be able to answer for, because it varies from hospital to hospital.
Don't underestimate me.
What is the approximate cost for both knee replacements?
Okay. Well, I spoke too soon. This question is often asked. And I always say that, if you were a film producer, I'll ask you, picture banane kitna paisa lagega? And there is no answer for that. Because you'll say, अरे भाई पहला मेरे को बोलो कि सेट कहाँ लगाना है, फिर उसमें तुमको अमिताभ बच्चन चाहिए, शाहरुख खान चाहिए, विवेक ओबरॉय चाहिए, कि कौन चाहिए? So the problem is that if I, as a surgeon, imagine in my head that I'm Amitabh Bachchan, then I will charge a lot more as a professional fee. Otherwise, if I think that I am Junior Mahmood, then I say, bhai, jo de dega chalega mere ko yaar, kar lo operation. But having said all of that, in most big hospitals, I cannot speak for the smaller nursing homes because there is all kinds of things going on. We talk about the bigger hospitals, like, you talk about your Kokila Bays, the Nanavatis, the Leelavatis, and Harkishan Das, and all of those. On average, in a single room, it will cost you approximately between 4 and 5 lakh rupees per knee. Approximately. Now, it may be a bit higher or a bit lower, I don't know. But that is the ballpark figure you look at. Most insurances will cover it.
Right. We have a question from Deepika, who asks, does glucosamine have any side effects?
No.
All right. And there's a question which Apurva Mehta has asked. So, learn that your respected father, the illustrious ortho surgeon, advised to avoid knee surgeries through a specific exercise, something like lying on a bed and pressing down the knee.
Oh my God!
Tall roll with several hundred times a day.
Apurva bhai, who told you this? This is classic Papa. No, ask him this. Let's see what he answers. Who told him this? I'm now curious.
Let's see whether he replies. Apurva bhai, please reply if you are still online.
Because this is the one exercise that patients even tell me today. When my dad's patients come to see me now, they say, "Ke Sahib ne jo bola tha exercise, wo hum kar rahe hain, abhi tak kuch nahi hua." And I'm like, you know what? My dad is killing my business. So, no, but those exercises are called what are known as quadriceps setting exercises. Absolutely right. You lie flat on the bed with your knee straight and you keep tightening the knee. And Papa used to say that you must do it 300 times a day, right? Now, I still don't know what magic there was in that, whether it was the magic of my dad saying it to the patient or something, but it seemed to work for a lot of people. And I have not been able to understand the physiological or biomechanical reason for it. But yes, that is the one thing that my father used to say all the time.
And what other exercises that you would recommend? Is there something that, for instance, somebody who's not had any issues so far, is there something that they should do apart from walking and ensuring a good diet, etc.?
Gym, lifting weights. And I'm serious about this. You go to the gym, you do squats with weights, you do leg press, you do your back exercises, you do abdominal exercises, you do everything. Right? I'm going to be joining the ranks of, I think senior citizen nowadays is classified as someone who's 60 or over. I'm going to be 60 next year. Right? I still go to the gym every single day of the week. As I told you earlier, 5:15 in the morning, I'm in the gym. If I'm operating, I go to the gym at 12 o'clock in the afternoon. I lift weights like a madman because I know what's coming. I know that sarcopenia is going to hit me. And I want to be ready when it starts to happen. So my advice is, whether you have a problem or you don't have a problem, go to the gym and lift weights. Do it under supervision of qualified personal trainer so you don't injure yourself. But please go to the gym and do resistance training.
And would you recommend massage?
There's no harm in it. Some people find that it helps them. Great. But it's not going to harm you. So absolutely, please do.
Given that masseurs are not really trained.
Well, I mean, but then there is the problem, right? So you need to find the right person, right? So just because they're not trained does not necessarily mean that, they're not good. It's just that they never got the opportunity to train. So some of them are untrained, but very, very good, right? And that usually comes word of mouth. you will say, "अरे वो मेरा मालिश वाला ना बहुत अच्छा है, एक बार उसको बुला के देखो आप," and that's how it works. But yeah, I mean, the massage as a therapy is useful. How beneficial, I don't know, but definitely not detrimental. So I'll tell my patients, please go ahead and try. It's not a problem.
Great. Thank you very much, Dr. Niraj Vora, for being here. Amazing presentation, and in your inimitable style, if I might say, you've answered all your questions. And of course, spoken about whether it's an Amitabh Bachchan movie or or whatever else. Uh, but uh, um, uh, but yeah, the thing is that it was an amazing presentation, and it was a very good session. I'm really glad that you were able to answer um, uh, most of the questions that have been asked over here. Thank you very much once again.
Thank you for having me.
To you and to the team at the Nanavati Max Hospital.
One second, Pradyuman, Mr. Apurva Mehta is saying something. Let me respond if possible.
Yeah, all right. So please, Mr. Apurva Mehta, please respond. Dr. Vora is keenly awaiting.
No, seriously.
You know the secret.
Seriously, the host has kept it off. Let me respond. Can we switch on his mic for a second?
Yeah,
just be easier for him to.
Just 1 second. Apurva Mehta.
Audio is closed. Yeah, now I think I'm audible.
Yes, Apurva bhai, bolo.
Thank you so much. Such a pleasure to listen to you, sir.
Thank you.
Personally, let me tell you that personally I had accompanied some patients to Dr. Lakshmi Kant Bhai.
Oh, okay.
And he suggested this exercise. And only 3-4 days back, one Mrs. Pathak, her husband told me that she was advised knee surgeries because of that particular exercise, pressing the knee or the towel. That cured her completely, number one. And my own younger brother Amit, perhaps he's listening on this, as we are talking, sir. Amit, we stay in Matunga, where he used to do his walk was limping at Don Bosco ground, where we have a good walking track. But after this exercise, he could run. Well, I mean, these were some.
Thank you.
He was a great.
Thank you. Thank you very much for still remembering my father. I really appreciate it. Sincerely, thank you.
We cannot forget him, sir. I mean, he was a great Jain, and he performed those avadans and all that.
Yes, thank you very much.
Took stopped so many, not only these, he stopped so many surgeries.
Thank you.
To the patients whom I had taken them, a number of patients I had the privilege of.
Thank you very much. Thank you very much. And Dr. Vora, so what do you say that, is this something that is going to impact your,
I hope not. I hope not. Nobody listen to my father now. Listen to me.
Thank you very much once again for being here, and we hope to have you once again on other topics concerning orthopedic issues. And to the team at Nanavati Hospital, of course, thank you very much. We will be back again next Saturday at 5 p.m. with another session of our Health Live webinar. Do remember that we have a host of other programs happening as part of Evergreen Club, as part of, Seniors Today is updated every day. In fact, we're going to have as I was taking the session here today, we just heard that the well-known actor, Satish Shah, has passed away.
Yes.
And so we're going to be carrying an obituary in the next hour or so on the Seniors Today website. And so keep following Seniors Today, keep following Evergreen Club. And thank you once again to Dr. Niraj Vora for being here. Thank you.
Thank you. Thank you very much. Bye-bye, everybody. Thank you.